Okay, well, I'm counting 6 members of the Commission on Aging, which gives us a quorum. So I will open the meeting. Sharon, you're cool?
Yeah, I'm cool.
Perfect. So the first order of business, believe it or not, is the discussion of the February minutes, since that's the last time we met. Does anybody have any questions or changes to those? Hearing none, can I have a motion to approve the February minutes?
I'll approve them. It's Jennifer.
Oh, great, Jennifer, perfect.
I don't know why the
Jennifer
camera.
as well, that's great. Can I get a second?
Second.
Thanks, all in favor? Aye.
Aye.
Any opposed? Hearing none, thank you very much. We'll then move on to Beth's Mather Center report. Beth.
I think I'm going to just summarize what we've been doing for the last 3 months or 4 months now. The center closed on March 23rd. Here in-house, the Corbin Cares and the Darien Foundation wonderful offering of the drive-through lunch. Took someone to be here to coordinate the whole thing, and it was absolutely wonderful for all the seniors that are still participating in it, because it was, especially in the beginning, people that were very, very apprehensive before they put the protocols in for shopping were actually scared to go to the grocery store. And on the others, well, I'll do one part at a time. So that this became a really important offering, and also the fact that we got to see people and got to talk to people. So it was more than just the food. There were 4 restaurants that participated, and we're up to, I think, 68 different seniors have participated in it since it started. It will be ending the week of June 29th, and that's the last full week. And then our chef will take over starting the week of July 6th. One of the things we're going to try to do is provide even more of a substantial, like, dinner, including dessert too. We'll be back to charging the $5 a day, but trying to give something. Those meals were all wonderful, but even more substantial we're going to try to be doing, since we're going to be doing the drive-through lunch indefinitely at this point. From the state, we are maybe opening September 1st. I'm not sure. But even if we do, with what the protocols are, the drive-through lunch will probably go until October or November, just based on the fact of the way that we can, if we have to stick with the protocols now, socially distance people. As you know, when you eat, you can't keep your mask on. So there's a little more, it's a little more dicey for us in terms of that. The other things that have been going on here is that basically I've had probably contact with over 300 people on a pretty regular basis, just doing connection calls and just answering questions and concerns. At the state level, we're doing affinity groups every single Wednesday. It's that some of the group is senior center directors, some of it are municipal agents, a combination of thereof. And each week, one week it's about reopening. One week it's about creating a virtual senior center online, which we're 14 of us are all actually doing that together, where we're researching information and things that we can put on the web, and then we're choosing what's appropriate for our specific city or town. The third week is a meeting about people who have no technology whatsoever, and how do we outreach them, and we're all working on ideas for that. And the fourth week, we meet Marie Allen, who's the executive director of SWACA, who's actually on the reopening committee at the state level. And we get a briefing from her, and then actually usually some more things that we need to do. Remotely, Marcy Rand helped Allie for a period of time. Actually, and Allie could probably speak to this better than me, but coordinated quite a few volunteers. Palmer's was wonderful in offering right out of the gate that people could call in and order. And Marcy coordinated, I think, over 100 volunteers. And again, Allie will clarify that. to do the delivery. And then I think in the later time, it went to the police who did it on all different shifts, actually delivering groceries to people, which was a huge help. I have some sad news for us. Happy news for Marcy. She's accepted a position in New Canaan that she, quote, calls her dream job. And after having an extensive conversation with her Monday, I can see why New Canaan's very lucky to have her. The 9 years that Marcy was here, she was integral in the program that we have right now set up. So it's sad for me, but I'm very happy for her because I care about her as a professional and a friend. But at this time, it's a bigger loss just based on the what's going on in the world right now and the challenges that we face reopening. It'd be nice to have somebody who knows my thoughts before they leave my mouth. But New Canaan is very, very lucky to have her, and this is a wonderful professional advancement for her. So I wish her all the best. But my stress level is going up a little bit. I know Allie is there for me too, because Allie's been awesome, and I want to say this, hats off to Allie. You cannot imagine the stress that she's been under in terms of dealing with. She'll tell you all the stuff she's been doing, but in the commission meeting, you won't hear about all the family work and stuff too. This has been an amazing time to see the dedication of this community and the employees of this community. I feel very proud to be part of Darien and to see how we handled all of this. And as we move forward into, it's a challenging time. We still don't really know if we're opening in September. I hope to be able to do one of the things we're working on right now is talking about even doing small groups. We're talking about this at the state level as well, with the protocols of temperature and surveys and protocols of cleaning, that we'd be able to even have small groups, it'll all be by reservation, keeping people safe, obviously, is the most important thing. We're moving forward with a lot of stuff in rolling that is unknown. So it's a little, I've heard other people say this, and I was on a call with the state, I think about 3 weeks ago, and a couple of the directors actually broke down in tears. You're working 70 hours a week and not feeling like you're getting anything done because the protocols are moved on you. And at the same time, you want to still keep connected to your community. I started to see people outside. Matter of fact, I had 3 visits yesterday of people that I can hear.
Beth, I just want to interrupt you for a second. If everybody could kill their microphones, please, if you're not speaking, because we're getting a lot of feedback. So if you could kill your microphone when you're not speaking, as you can see, I'm killing mine. So if possible, that'd be great. Thanks, everybody. And Beth, sorry to interrupt. Keep going.
Oh, no, that's okay. So I saw 3 people yesterday who don't have family locally, just because it was beautiful weather, pulled up. I sit on the park bench there, and they keep their window rolled down. And this way they're far enough away that I can every now and then, if they don't hear me, I can just lift my mask a little bit, because that it is very hard to communicate with a mask on, I have to tell you, because people do they rely more on your mouth, looking at your mouth, than you think, especially if they have a little hearing difficulty. But those kind of visits, I think I'm going to become a more regular thing. Those 3 people really, really needed the contact, and I'm connecting them with other senior callers now. That was one of the things that Marcy and I start working on, that we were trying to identify groups of seniors as volunteers and then put them with other like people, so that we can do some community calling too. No more than 4 or 5 people on a call, but it's getting everybody's permission and coordinating all that. So that's going to be something that we do moving forward as well. I don't know what we'd do if we weren't in a technological time at this point, that we didn't. I'm not a big computer person, and I'd much rather hug you and see you in person. But if we didn't have this, I don't know what we would do. And there are people that absolutely have none of this. So that's one of the things when our staff comes back, I'm gonna have our secretary, Eileen, start working on. going down the list of all of the members that we do have to find out if people don't have technology, if it's not a financial thing, if they want it, how we can help them get it, and what, give them that process too. Because an iPad is kind of easy to use. So we're exploring all that right now as we move forward, just in case there's another surge, and people need to stay in of that age group especially. So anyway, that's what's happening here. And the whole staff's coming back, the part-time staff, on the 29th. And just to let you know, the job did go out to different professional agencies as well, and probably generally and Indeed. But that's a 3-week process just doing that. Forget about the interviewing and all that. So we probably, hopefully, if we get some good candidates, we'll have somebody by August or September, I hope. That's it for me.
Thanks so much, Beth. Anybody have any questions for Beth? Hearing none, thanks very much. Allie, passing it on to you for Human Services. Allie? Yes, something's going wrong with Allie's microphone. Allie, we're hearing like a squeaking like in a Mickey Mouse cartoon.
Yeah.
Same. Not sure what's going on there. Oh, maybe she's gonna log back on.
She is.
Let's hold for a second, see if she logs back on, and let's see what happens. Okay, go ahead, Allie.
Can you hear me now?
Much better, thank you.
Yay! Okay. Good morning. Thank you, Beth, for the kind words. It has not been dull, to say the least here, but I will focus on the work that we've been doing with seniors, of course. Naturally, we've been working very closely with Beth and the Senior Center and with At Home and Darien to make sure, our most vulnerable residents, that their needs are met. Clearly, it's been very challenging, and as Beth said, many of our seniors don't have not good access, but don't have access to technology like many of the younger residents do. So that's clearly a challenge, and I think it's a great idea to see what kind of access we can help them with, and I'll be happy to work with you on that, Beth, if we can assist in any way. Our emergency call list grew from about 70 people to 98 people, and as Beth was saying, Marcy very willingly helped us since the Senior Center was closed, and Cynthia Hall, the other social worker, was on maternity leave. So Marcy jumped in and took over that list and was calling each senior on the list once a week to check in. In the last few weeks, we've tapered that off because there's nothing new to check in on them, but we make sure that they know they can reach out to us if they have any needs. Beth was referring to Palmer's and their delivery program. Mid-March, I was in contact with Cindy, and we were trying to figure out some kind of plan to have the groceries delivered, and it took off. And again, Beth, I was just saying how Marcy did the emergency call list for us. Thank you. And willingly took over the coordinating volunteers with Palmer's because it skyrocketed. The need was tremendous. The people in the community volunteering, some of you on here also volunteered. And it just took off, and they have since, and so they had plenty of volunteers, or they eventually had plenty of volunteers, and the police department and you probably read an article about it, I think it was in the Times, and the Norotan Heights Fire Department were delivering for Palmer's, which was nice. And now they have since hired people, so there's no longer volunteers doing that. There's a small fee for it. If anybody has an issue with that, any seniors or people who are quarantined have an issue with that, Cindy knows that they can call me directly, and we will cover that cost if necessary, if they have financial needs. So far, we've only helped one senior with that, but we're happy to. What else? Let's see. Terry Wood has very graciously offered to help us with her the contact she has with the Department of Labor for some of our clients who've had difficulty accessing unemployment benefits. Right now, there's 3 cases she's helping us with, and one of them happens to be a senior. She was a nanny and out of work right now. So thank you, Terry. Of course, she comes to save the day. We've had 4 protective services cases since March. This has been extremely challenging. Naturally, we don't want to go into the homes. Typically, protective service social worker and myself and or Cynthia will go and do a home visit as soon as the case is opened. It's been very challenging, but we've figured ways out to do things. And then of course the families, we naturally rely on families as a huge support for anyone going through some kind of crisis that protective services is involved in. They're limited if they're not local. Even if they are local, they want to keep their distance, and so there's so many factors that go into it, but we're all managing and taking it day by day. We were a little late to the game just because we were down since Cynthia was on maternity leave, but we did just join last week. SWACA is has a program for grocery delivery bags for seniors, and it's free of charge. And once a week, we had the second delivery this week. Once a week, we have 20 residents in town, or 20 actual homes. A few of them have couples in them, who receive a bag of groceries for free. It has fresh produce, eggs, butter, milk, toilet paper, and a few other non-perishable items. And Beth Longo in our office has graciously offered to deliver them. So she delivers to each of the homes, which is nice because they appreciate the food, of course, but also the socially distanced visit. So so far so good. It's only going through the end of the month, but at least we'll get 4 weeks worth of that service. Let's see, renter's rebate, another challenge. Normally Diane Barston in our office, she's the one who coordinates that program. She has the seniors come in and she meets with them and gathers their documents and so on and so forth. So we have to be a little creative, and she coordinates with them via phone. A couple of them do email, most of them don't. And then we just do what we've been doing since we've been closed. Human Services has been here since since Town Hall was closed. We've been working and providing all our services. We have clients stay in their cars. They call us when they're out front of Town Hall. One of us runs out there. For renter's rebate, for instance, we gather the documents, run in, copy them, bring them out. Or if they have to sign their application, same thing. So we're making it work. They have plenty of time. Renter's rebate goes to the end of September. I don't know if you guys remember, but last year we started for the first time participating in the Senior Farmers Market Nutrition Program. And we're going to do that again this year. We had, I don't remember the exact amount, but it was about 30, a little over 30 residents last year, but we got a late start to it. And that's going to take place again this year. So we're thrilled about that. It also was pushed back a little bit, the starting date, so we have not received the booklets yet, but we should receive them in the next couple of weeks, and then we will advertise it. And last year we received 50 booklets, and we're asking for the same this year, so hopefully we can get some new participants. Oh, big news, the Royal. They are hoping to move the residents back in mid-August. Royal is the old Town Hall homes, you all know that's the official name. So the 16 residents are hopefully moving back. They are reaching out to 2 men in a truck, not the residents, but the Heights and the Imagineers, the management company. And then they are hoping to move new residents in September. I can't believe this is actually happening. It went by fast for me, but I doubt it. I know it didn't go fast for the seniors. I actually did go, I don't know if you guys recall, but I think it was in January, maybe it was February, that I went to the meeting they were having, the Housing Authority meeting. And my brain's a little fried, so I don't remember if I mentioned this at the last meeting or not, but I did ask to be part of the lottery when they chose the names, and I did, and it happened here. Originally, they said it was going to be in Hartford, but luckily it was right here at the Heights, and that was on June 4th, and I witnessed them pulling the names literally from a hat, putting them in, pulling them. They are still taking names for the waiting list for all 3 tiers, believe it or not. There were a total of 79 people. They were going to take up to 200 for this lottery. They actually had 79 names that they pulled because they had some more than, they didn't reach 200 because of the current crisis we're going through. But I mean, they're assuming that's what it is. So there were 79 people for roughly 30 spots. That's not including the returning residents. It's not including, I think there were about 4 or 5 on the wait list that were still interested. So they did follow through on offering things to the people on the wait list as we had hoped they would do. And now they have, as of June 4th, they said they still had a few openings for the top tier, the 60% of the area median income. They had a few openings. I don't know if that's changed in the last 2 weeks, but if you know people, spread the word. I did ask them yesterday if they could give me the exact numbers for each tier. So if I get that, I'll email it to, I will get it. And if they don't give it to me, I can find it. I just thought they might have it right at their fingertips. And they are taking names for all 3 waiting lists. So spread the word. So the waiting list is not that long, considering they have 79 people, 30 spots. And so anyway, that was hopeful. It went very smoothly. I was very, yes, did someone ask me something? Oh,
Is
yeah.
this something that should get some exposure with the Darien Times and our town's media?
Yeah, actually, I had spoken to Sandy Fox last week about something else, and I did bring it up with her, and she was going to reach out. This was, I think, on Friday, and she was going to reach out to Joe Warren and or Imagineers and speak to them. So I filled her in on this. So she, I think, is going to take it and run with it, I'm sure.
Great.
So yeah, so I was thrilled. It went well, and fingers crossed that everything goes smoothly especially for the returning residents. We do still want to have some kind of presence there. Of course, everything's changed because of COVID. We originally thought we're going to be there once a week. Who knows what we're going to do now, but I have been in constant communication with Imagineers, the management team, and they know that we want to be available for residents. So we will work it out. We'll figure that plan out.
Allie, Carla Thompson here.
Hi,
Hi, what is the income for these people?
Well, that's what I will get you the exact numbers for that. It's 60% of the area median income. I don't have the numbers at my fingertips, but when I get them, I will email them to all of you.
Okay, good.
It's low to moderate income. It's not exceedingly low, because that would be, they have the 60% of the area median income, 50% and 30%. The 30% were all filled, I believe, before the lottery with mostly the returning residents.
Okay.
They have a certain amount of apartments in each tier as well.
Yep.
It's kind of complicated, but they're being very, they're reaching out to me and we're working together. So I'm happy about that.
Thank you.
You're welcome. I think that's about it.
Anybody have any further questions for Allie? Hearing none, thanks so much. So our primary topic on the agenda relates to Governor Lamont, and he's just created a task force, and I will put on my cheaters. We sent a letter to Governor Lamont, as you all know, on May 11th, 2020, raising certain issues relating to the nursing home situation. And specifically, we asked that they take all measures necessary within nursing home and assisted care facilities to significantly reduce the spread of COVID-19, including frequent testing of all senior residents and those who come into contact with them. We asked that they screen employees, vendors, healthcare professionals, and service providers before allowing them to enter any building populated by seniors. Designate certain hospitals and institutions for positive COVID-19 patients. Provide all necessary personal protective equipment to every employee serving our seniors. Give towns and cities up-to-date access to information about virus cases in each of their facilities, which include assisted living, nursing, and long-term care, so that local public health officials can take immediate action if outbreaks are detected, and permit residents of such facilities to install cameras or other recording devices to allow them to properly communicate with their family members and caregivers. So our nursing homes and care facilities actually fell between the two extremes that we've seen in America. Governor Cuomo, who though lauded by everyone for his wonderful press conferences, his administration probably had the biggest screw up in the entire COVID-19 response, which was to demand that nursing homes take positive COVID-19 patients. On the flip side, you had the Florida governor who banned nursing care facilities from taking positive COVID-19 patients from hospitals. We fell right between those two, where Governor Lamont decided to remain silent on this issue. So nursing homes themselves decided whether to take positive COVID-19 patients. And where you see this split, sadly, was most especially in Old Saybrook. In Old Saybrook, this is a June 11th article from the Connecticut Examiner. Over the last 3 weeks, 69 residents tested positive and 19 died from COVID-19 at a place called Apple Rehab, a 120-bed care facility. And what was truly sad about this is Apple decided to take these, people from hospitals, bring them into their facility, and effectively infect other people. It's so unfortunate that these are making these kinds of decisions when we know that a nursing care facility, because of the sheer amount of care that nursing home patients require, that is, 3 to 4 hours a day, there's somebody standing over you, taking care of you, giving you food, doing whatever else is necessary from a personal care position. But the flip side of that was Glade View Healthcare and Rehabilitation in Old Saybrook, which chose not to accept patients testing for COVID-19, and they've had the opposite result, which is, and they're in a much better position in terms of having no positive cases, no deaths. So one of the things that we need to be very clear about going forward is that we need to work to make sure that everybody understands, let's not do this. Let's not bring positive patients into Connecticut care facilities. Thankfully, Connecticut did have the sense, starting in mid-April, to create 5 recovery centers to help ease capacity concerns on the hospitals. Okay, so we had a situation where at least there was a midterm step. But once again, if a nursing care facility decided what a great idea it was to take positive 19 patients, they could do so. So at the moment, at least, this is still the law. That is, we're in a position where healthcare facilities can continue to take them. A secondary problem right now is that Governor Lamont signed an executive order granting healthcare facilities immunity from civil liability for injury or death during the state's COVID-19 emergency. That immunity, of course, is, you could say, well, what do they do? They're really not trained and all this stuff. Well, that's the reason why they shouldn't be taking COVID-19 patients. And that it creates at some level of financial incentive for these nursing homes to take COVID-19 patients, potentially exposing their other patients to them. So we've got to continue to be vigilant on this issue. Governor Lamont has created a task force to study this. They expect to have some results in August, ahead of what could be a second wave in the fall. But obviously, it's critical that what happens is that we follow Florida's lead, ban nursing homes from taking positive COVID-19 patients, and secondarily, make sure these 5 recovery centers are still in place. Because the problem, of course, is the hospitals get overwhelmed. They don't have all the beds they need to be able to take care of these folks. So they got to, quote unquote, discharge them somewhere. Well, the 5 recovery centers dedicated to positive COVID-19 patients is exactly what we need, because we need to be in a position where we say, where there's already COVID, let's treat COVID. Where there is no COVID, let's not create a significant problem for these nursing care facilities. So we're going to continue to be engaged on this. We may get another letter out sometime between now and July. I want to see who's on this task force that's not been formed yet, and see where we're going from there, and keep on top of this, because it's obvious to me that some pretty bad decisions have been reached related to COVID. Obviously, it was on the fly. Everybody is having a tough time figuring out what to do. But at the same time, once you realize that our senior citizens and elderly are by far the most likely to be victims of COVID-19, we just have to protect them inside these facilities and not allow positive patients to be discharged to them, which just doesn't make any sense. So we'll continue to do that. The other thing that, and Peter Etter has taken a major role in this, which is the trying to get the opportunity for residents to have cameras in these facilities, not only so that they can communicate.
Your voice is frozen up on me just at the
but
moment.
that their loved ones are in a position where they can communicate with, nursing home patients, both those who were positive for COVID-19, but just in the net normal situation. So for example, in my case, my parents aren't in an assisted care facility; they're in their regular home, but they live in Florida. My brother lives in Maryland, my sister lives in Westchester, I live in Connecticut. It would be great if, when the time comes and they are in such a facility, that we could talk to them by video. So I'll turn it over to Peter.
His mic isn't on.
Yeah, we've been very, very busy on this issue, really. Can you hear me?
Yeah,
Can
you're
you hear
coming
me
in and
okay?
out, Peter. Why don't you keep going? Let's see how it works.
Okay, I'm saying we've been very, very busy with AARP on this issue. There's really two dimensions of it. One is to rescind the civil immunity for nursing homes, and the second is to put in place resident cameras. And we've heard on Friday that it looks like the legislature will be coming back into session. It's a complicated process, because on the first one, rescinding the civil immunity, that the governor has to do since he put it in by an executive order. On the resident camera, that really would require some legislative activity. There are 13 states in our country that have this now. So, and Texas goes back to 2001. And we think it's really important. I got an email yesterday afternoon from Meredith Painter, okay, and she is the state long-term care ombudsman for aging and disability services. And she was responding to emails that we have sent now to our legislators. And by the way, quick response from Terry Woods, a very strong positive response from Matt Blumenthal, a response from Bob Duff, haven't heard yet from Carl Leone, that they will indeed get behind looking at this. But let me read you her short email, and then I will send it to Joe and he can put it out with the minutes of the meeting. It says, "Good afternoon. The long-term care ombudsman program is in all caps, the only word in that memo with caps, full support of the camera bill. This is our second year trying to get it passed. We looked at what worked in other states and where we thought there could be some improvement. I truly believe that we are going to say this is the resident's home, then they should all have the same choice of protections that you and I have available to us as a choice in our own homes. That leads me to the second matter you addressed. I believe that civil immunity needs to be reversed, and soon. I would be happy to partner with anyone in addition to AARP on this matter. The residents and family members that our office serves deserves this type of accountability. It's a rights issue that needs to be addressed and protected for all of the long-term care residents in the state of Connecticut. The long-term care setting is the place that they have chosen to live and receive their long-term services and supports. It should not mean that they lose any of the rights that you or I, as residents of Connecticut, have. So that's a pretty strong, I think, endorsement. It's going to be a grueling uphill fight, because nursing home owners are going to perhaps be against it. Some may. The more progressive ones, I think, will see the advantage. Also, the unions that are involved, because again, they're feeling that the presence of those cameras could act as a check on what they do. But the whole point of what we're doing, and we see more and more of this, is to deal with the isolation and the fact that we have the tools. We use the tools in our own lives. And if I've chosen to live in Atria, in wherever, Solid Woods, or in any kind of risk, I should be able to have those same types of communication channels open to me. So that's, I hope you've heard me, and I don't know if any of you have questions, but I've spent I've been zoomed out on this, believe me.
Thanks for all your good stuff, Peter. Anybody have any questions for Peter?
Just as anybody, as a representative of the Connecticut Association of Nursing Homes on this, in this dialogue, because, you know, I had written to Peter earlier on, and I have a personal stake in this. My daughter works in St. Joe's, and there was no PPE provided to them. She had one N95 mask for 6 weeks that she put in a bag at the end of the day. She was stapling the strings when they broke. And our wonderful ombudsman, I contacted her from the beginning of March till the end of April when they finally got their PPEs, and with no satisfactory answer. And I also then talked to Carleton, Jewish Home, Lord Chamberlain, different nursing facilities that I know people that worked in. There were hospital admissions put into St. Joe's that I can speak about because of her knowing my daughter, that they had St. Vincent's and Bridgeport just dumped people in. The nursing home did not take them willingly. They cohorted people from the beginning onto the 5th floor of their facility to try to stop the spread. They were not given any support not to take people. They didn't have a choice. So that's not going to come out, and the ombudsman's not going to own up to that as far as I'm concerned. But I have to tell you, front line, I was watching this, talking to several nurses in the nursing homes. Now, also, the iPad. My daughter has been doing iPad visits since she started working there almost last summer. That is the way they communicate with their families when families can't come in. Right now, they're bringing people outside. They can finally see them outside, 6-foot distance, so that they're arranging appointments. So there needs to be somebody on the other end that actually says what the governor wasn't doing and what the ombudsman office wasn't doing, and that these poor people had nothing. I mean, not right now, they're in full gowns. They're all wearing protective. She's even, and my daughter just cut all her hair off. She's in a skull cap, mask, and a shield. But they didn't have any of that until the end of April. And they did lose 25 people at St. Joseph's Manor. And also numerous of them got sick. And the other thing that wasn't available that nobody's mentioning, there were no Fakaktin tests anywhere. So they couldn't test the people coming in. They couldn't test the staff. Now at St. Joe's, they're testing the staff every single week. So part of this, it was a cluster because nobody knew what to do. And of course, I agree with Peter, the better facilities were probably ahead of the learning curve because they were dealing with their infectious disease nurses head on, and they were frustrated. But the first call to the ombudsman, she told me, well, they should be talking to the public health departments at the state level if they don't have PPEs. That was her job, to advocate for everybody that was in that nursing facility, not the staff, but of course the staff indirectly, because if the staff's safe, the people are safe. She was overwhelmed too, as far as I'm concerned. I don't know about every region, but she was. So I think before there cannot be a balanced discussion unless their own association is involved in it too, and they could, to a certain extent, say how, so they're ready for August, which I think they are now. I mean, they've got stockpiles of stuff now, or September when the fall hits. But they did not have the choice not to take people initially. They did not have that as a choice. So we need to get like what the real story was, and then from there, proceed. Now we know all the right things to do, we hope. And I don't know when those recovery centers were actually finally established, but we should look at the data of that too and make sure that they don't go away, because I'm sure people don't, even for their own health, all the workers don't want to jeopardize their own health as well, because you can get this more than once, and people have gotten it more than once.
Well,
So I just want to put that aspect into it too. Get their association involved, because they really need to all be mandated to do the same thing too. Because some facilities, again, are much better than others.
it's been a political minefield, and as we know, politicians won't go back and look at their mistakes or apologize for them.
There you go, Pete.
We've been doing this. I mean, we've been on this since early March. And one of the things ARP is doing is trying to line up as many partners as we can find, because one of the champions of the anti-cameras is the ACLU. The ACLU feels this is an invasion of privacy. And again, they haven't chosen to make this a public fight because I think they're going to understand they're going to lose it as a public fight. So again, you're absolutely right. We have to line up all the advocates we can. And I'll even give you one other quick personal observation. I think putting together these temporary warehouses for people that are positive and instead of bringing them back, again, the long-term solution is for nursing homes to anticipate that and be able to set it up within their own facility, because the poor people that have it and are suffering isolation, now they're moving to out of a hospital and then to another facility where they're even less connected. So, I mean, there's so many isolation issues that we have to deal with. But you know what? This is what happened when this pandemic hit us and nobody knew how to deal with it. So
Right.
hopefully now, we can marshal our forces, put our best thinking together, and make sure we do what's right for us old people.
For sure.
Thank you, Peter. Thank you, Beth. Great points. And we'll keep moving, and I will be monitoring, and I'm going to be very interested to see who is appointed. So I will certainly coordinate with all of you, but especially with Peter and Beth, as to the individuals on this committee, because that's going to be a critical component to make sure that all voices are heard. Especially from the nursing home facilities and ideally nursing home employees, because nursing home administrators and employees obviously have different views and different interests relating to the situation. Great, thank you. Any old business? One piece of old business to thank Allie and all of her efforts, especially relating to the Royal, formerly known as the Old Town Hall Homes. It's great that we were able to get that moving so fast and especially protect those people on the waiting list from the previous facility. That's just so critical. So thank you for leading that effort to make sure that we protected those folks.
You're welcome. Can I add something to that? That was
Sure.
a perfect segue, because I got an email while we're talking, I'm multitasking, that the income limits, Carla, you had asked, the income limit for the 60%, which is the highest tier that still, as of fourth, had some openings, is 60,000 for one person. The maximum income is $60,660. The 50% tier, the maximum income for one person is $50,550. And the 30% tier, maximum income for one person is $34,650.
Oh, that's great, Ellie. Thank you.
You're welcome.
Great. Hearing no other old business, do we have any new business? Hearing none, I will. Oh, Carla, did you want to say something?
No, I'm good.
Okay, cool. Just saw the green light come on. So we will do this again either via this kind of go-to-meeting software in July, or we will do it in room 119, depending on town hall status at that time. As you know, we moved into period 2 of the opening up, so I'm not sure when 3 will occur or when town hall will decide that they feel comfortable having folks come in. But hopefully September, if nothing else, perhaps, Beth, we can think about having a Commission on Aging meeting in the cafeteria spread out. We'll have to see, or we keep doing it by go-to meeting, or we do it 119. This is obviously a moving target as to where we meet and how we do this, but I do think it's important that we continue to meet on a monthly basis. We don't have currently a scheduled meeting in August, so we can talk about in July whether that's necessary or not. But we'll certainly go forward from here. Anybody else? Go ahead, Peter.
I see Jean is on. Anything from At Home in Darien that we could add?
Hi, thank you. We have been continuing to provide services this entire time, rides limited, of course, and people are tending not to want to go out. It's just starting to pick up now. And, we had to put in place a lot of safety measures to make sure that those riders and our drivers were safe. So we've been doing that, doing a lot of grocery shopping, both with volunteers and with staff members shopping for people. So we are happy to have, been able to continue to provide important services, keep people connected, and we will, build on that as the opening phases go on, and hope to get people out and get them information. So, Allie, when you get that information about the farmers market, and you want us to share it, and whatever the senior center wants us to share, we're trying to get that information out to people so that they have that connectivity.
Let me throw another observation, and again, it's come out of some AARP meetings I recently attended, and that's this question of isolation. One of the things we're starting to find is a core of people that are comfortable being isolated, and they oughtn't to be. In other words, these are people that shouldn't necessarily be in isolation, but they're finding that with the tools and technique, they don't want to come out. And in a way, we see that as long-term issues again in making them parts of the community. And I think again, this is something that we have to start to think about and plan about, like with the senior center and with services. There are some opportunities to draw them out. We may have to do that.
Wait a minute. Yep, it's on. Go ahead.
Allie, it's Jennifer. Are there restrictions on anyone seeing the new senior housing? Are they available to look at?
That's a good question. I don't know, but I will find out and let you know. I would imagine there's restrictions like there is for everything.
Some people have had questions about, what they look like, and I said I can ask if you can go and see them, make an appointment.
I will reach out to Crystal. She's the local property manager for Imagineers. She's one who just emailed me while we were on this meeting, and find out, what the procedure is, and I'll send an email to the group.
Okay, thank you.
Welcome. While I'm talking, I just wanted to clarify that Town Hall is open, but it's only by appointment at this point. So all departments are here and available, and all services are being provided. It's just a little different than usual. But.
Great. Any other new business? Hearing none, can I have a motion to adjourn?
A motion?
Thank you. Second?
Second.
All in favor say aye.
Aye.
Great. We'll see all of you in July. Thanks so much for mastering this technology. Good work, everybody. Have a nice day.